Today we're going to talk about warming up, cooling down, and why you need to do both. So, two major reasons why you need to do both. I'm just going to give them to you right off the bat. Injury prevention, number one, and number two, performance. Again, a warm-up is just getting your muscles ready to do whatever activity you're about to do, whether that's going to run a half marathon, mowing your lawn, playing with the kids, etc. You want to make sure your muscles are nice and loose. Think of them as a rubber band. If you put a rubber band out in the cold or you put it in the freezer and then try to stretch it out as much as you can, you're probably going to break it, kind of like a muscle strain. That's what we want to prevent. We want to warm up those muscles, make sure they're nice and loose and pliable and can let you move through the motions that you need to without any problems. Cool down. Important things to focus on with the cool down are bringing the heart rate back down to where you started at. You want to focus on bringing your heart rate back down, and again we're going to focus on your flexibility now. So you're going to stretch again. You'll start your cool down with either a slow jog, slowly walk down. You can walk for 5, 10, 15 minutes if you need. Whatever you need to kind of catch your breath, take a few deep breaths, and kind of take yourself back to where you started. At the end of your cool down, you should feel more relaxed than you were during the beginning of your exercise. Maybe not right before you started warming up, but pretty close to that. Static stretching is what's going to show you long-term gains in your flexibility. So if you're really saying, hey, I got a little bit looser after I stretched my hamstrings in the beginning, but I'm kind of, feeling tight throughout the day, you really need to focus on your cooling down and your static stretching, because that's what's going to help you days, weeks, months down the line.
Some of the two most common things that we see are hip pain and ankle pain. Some of the common causes for this is overuse. With overuse, oftentimes comes improper training if you're not doing a proper warm-up before you go out and play your sport, and if you're not stretching afterwards. That's definitely going to play a big role and can definitely put you at risk for injury. Another thing that is a common cause is increasing your intensity too much too soon, too quickly. Especially in the fall or in the spring, you've had a little bit of a break from school, you might not be as active during your off times before your season starts up, and then you just go at it full speed, and that's definitely going to put you at risk for more injury. Another one is not doing enough targeted strengthening. Really honing in on those stabilizing muscles in your hips and also your lower legs and your ankles is definitely going to put you at risk for hip pain or ankle pain, even an ankle sprain, or more injuries in through your hips, and it can go all the way down the chain and affect your knees as well. Muscle imbalances, if you have certain muscles that are tighter, that aren't really activating the way that they should, or weakened muscles that aren't being strengthened is definitely going to be a common cause for hip pain and ankle pain.
Just muscle tightness or tissue tightness, soreness, etc. And that is typically what you'll feel. You go for a long walk and your legs are a little bit stiff and sore that day. But then what happens over the course of the next 12, 24, 36 hours is the real actual pain component of it gets going. And what happens is that it comes on from an increase in use or an overuse. Think of your muscles as being like a rubber band, and so those rubber bands, those muscles have to stretch, or that tissue has to stretch repetitively as you're going for that walk, or as you're bending over and pulling leaves or pulling weeds in the backyard, etc. And so that muscle that has to repetitively stretch, at some point in time it starts to not be able to stretch as much as it needs to, and so it starts to get tight. Well, that tightness is what forms, those knots that you think about, right? You got those knots that are right here, you got that knot that's over here, and those knots keep the muscle from being able to stretch out, but also those knots start to create that tightness or that tension that puts pressure on things. Well, what really gets pressure on it when we're talking about pain related to muscle or tissue tightness are these things called receptors. So in your muscle, you have thousands of receptors, and the receptors send messages back to the brain. The brain processes those messages, and when that muscle is sending an increased response, it overwhelms the brain, and the brain doesn't really know what to do with it, so it senses this perception of pain. And that's really how pain is perceived, or how we feel pain related to some tightness or some soreness that was going on in the muscle.
If you need to come in and speak to someone about a more specific warm-up and specific stretches and things you can do to help yourself, come on down to Loudon Sports Therapy Center. You can either click the link below or call the number at the bottom of the screen, and we'll be happy to help you.